A dramatic surge in coronavirus infections in Italy. The number of cases jumping from 3 to more than 200 in just a week, with 6 reported deaths. Fox News correspondent is in Milan with a closer look at what's going on.
Europeans had been concerned about the coronavirus, yet felt relatively far from trouble till now, when the number of cases in Italy began to snowball from a handful to well into the 200s Monday. Authorities are still trying to figure out the source of the latest outbreak as they caution against panic, but urge caution.
Maybe in our country we have a social life that is very florid, very expansive. We have lots of contacts. We shake hands, we kiss each other, we hug each other.
Tens of thousands of Italians in the north around Milan and Venice are under lockdown. Schools, churches, and theaters are closed, with many people being told to stay at home. There has been a run on stores.
The pasta shelves are empty. What's happening? Not even when there was World War II was there such panic.
Meantime, worry grows about the effects on the economy. One of the highlights of the winter season, the Venice Carnival, was cut short, and Fashion Week was not as well attended or vibrant as usual, with Giorgio Armani deciding to do his show in an empty space, streaming it live. Italy's first 2 cases were an elderly Chinese couple. They were tourists. They'd been in a group. It was easy to track their movements and contain the situation. But what set off this last outbreak, this bigger one and more worrying one, was when a 38-year-old Italian man became sick. Nobody suspected he had coronavirus. Unwittingly, he went ahead and spread it quite broadly. And the problem tonight is no one seems to know for sure who gave it to him initially, that person being referred to as Patient Zero and being eagerly sought this evening. In Milan, Amy Kellogg, Fox News.
More senior citizens are lighting up. A new study shows the number of people over the age of 65 who smoke marijuana or use edibles went from 1% in 2006 to 4.5% in 2018. Use was highest among women, minorities, and those who were married, college educated, or who had a mental illness.